Good evening, all. I am Dr. Nitish Pasale, President of Pan India Discussion Forum team. And today I welcome you all to the seventh discussion forum meeting from Pan India on the topic of high carbohydrates and diabetes mellitus, facts and the myths debunked. Before beginning our today's session, I would like to give you a brief introduction of Pan India. So Pan India, that is the Physicians Association for Nutrition India, was established in 2022 as a part of the Pan International Network. Pan India aims to educate healthcare professionals about the importance of nutrition in preventing, managing, and reversing chronic diseases. We aim to raise awareness among the general public and expand its international network to update knowledge and collaborate with organizations which work in the field of nutrition. Pan India's mission is to integrate nutrition specific intervention in the field in the healthcare system in India by empowering healthcare professionals with the tools, techniques, and know how to treat their patients with the power of evidence-based nutrition. On our leadership board, we have Dr. Nicholas Oppenweider as a co-founder and current chairman of the board at Pan International. We have Dr. Alan Kornberg as an advisor to Pan India and Dr. Rajina Shahin ma'am as medical director of Pan India. Pan India team, talking about the Pan India team, there is a strong medical pan team structure including doctors, nutritionists who contribute as a program manager, ambassadors, and volunteers, and also international team who are actively involved at various capacities. The doctors, faculties, or medicals who would like to get associated with PAN can join us at various capacities like ambassadors and volunteers to help pass the mission forward. Now, I would like to introduce to you all our today's panel. On our panel, we have Dr. Maitri Shankar ma'am as our first panelist. Maitri ma'am is a nuclear medicine specialist in Bangalore with over 25 years of clinical experience and expertise in her niche field across USA and India. She has had extensive training in her specialty for various prestigious institutions such as UCLA, Cedars Sinai, Children's Hospital of Los Angeles, King Brew University, University of Texas, and Harvard Medical School. Ma'am is a board certified lifestyle medicine physician. She leverages her 30 years of experience in the US and India to champion wellness through functional, lifestyle, and integrative medicine. Ma'am is a co-founder of the Green Foundation India and also the creative head of the Green Hub. Dr. Maitri Shankar wears many hats. She is an author. She also a TEDx speaker and a national award-winning organic gardener. Welcome to the panel, ma'am. Our next speaker is Dr. Pratyusha Narela, ma'am. Ma'am has started her career as MD physician and evolved over time as a holistic healthcare physician by acquiring professional expertise in various modalities like nutrition, diabetes, positive psychology, lifestyle medicine, and pranic healing. She is the recipient of Dr. APJ Abdul Kalam Health and Excellence Award 2023 and Woman of Substance Healthcare Icon of the Year 2024. Ma'am has 12 years of rich professional experience of working in renowned organizations like Apollo, Medicity, MedPlus, Shalini Hospital, PHFI, and she has treated over 10,000 plus patients. She is currently Chief Consultant, Founder, and Director of Praveha General Diabetes and Lifestyle Clinic, Himayat Nagar, Hyderabad. Welcome to the panel, ma'am.
Thank you.
Okay. So our next panelist is Dr. Deepa Shukla, ma'am. Ma'am has a bachelor's degree in naturopathy and yogic sciences, and ma'am has done her MD in clinical naturopathy. She has more than 11 years of experience, and she is currently a part of integrated health and Wellness Clinic at AIMS Jodhpur. Ma'am is also a part of four ongoing yoga projects in collaboration with Department of Cardiology, Department of Community Medicine and Family Medicine, and also the Department of Surgical Oncology at AIMS Jodhpur. Ma'am previously has been invited as a panelist and a speaker in various conferences and at various institutes. Welcome to the panel, ma'am. Originally, there were two more panelists supposed to be joining for today's discussion forum meeting, but due to some unfortunate reasons and unavoidable reasons, they are not able to join today. But they assure us they will definitely join in our future meetings. Now, I would like to request my colleague Dr. Vindhya ma'am to continue with the topic introduction and the discussion. Over to you, ma'am. Vindhya ma'am.
Thank you, Dr. Nitesh. Yeah. Thank you, Dr. Nitesh. Good evening, everybody. As prevalence of type 2 diabetes is on the rise worldwide, diet and lifestyle, particularly plant-based diets, are effective tools for type 2 diabetes prevention and management. Plant-based diets are eating patterns that emphasize legumes, whole grains, vegetables, fruits, nuts, and seeds, and discourage most or all animal products. Today, let's debunk myths and facts about the high carb, high fiber diet in prevention and management of diabetes mellitus. So let's begin with the first question. The first question goes to Dr. Pratyusha. Ma'am, when we hear diabetes, the first thing that springs to mind is sugar. In fact, in India, in layman's language, the disease itself is called sugar. So could you please briefly explain how the sugar became the main culprit for the disease onset and progression?
Well, I totally agree with this. Most of the times in layman's language, it is sugar. Even many of the patients call diabetes as sugar. We also know like Apollo sugar clinics are there. There are so many. We talk often about when it comes to diabetes, we'll often relate with the term sugar. How come it became prevalent is like maybe it is a catchy term first of all, that's how it started. And also our focus mainly on the carbs. When it comes to diabetes, the main focus will be on carbs. That is the reason it has become very popular. And also most of the times, whenever the discussion around diabetes starts, the discussion around carbohydrates starts. But when you're mentioning the carbohydrates, usually it is not a regular thing to mention like complex carbohydrates are good, simple carbohydrates are bad. I've followed many contents, like many people, influencers talking about when they say carbs are not good for sugar, diabetes. In a way, it is misleading because when you are talking about carbohydrates, always need to mention that simple carbohydrates are not good for diabetes, but not the complex carbohydrates. Because it is like not mentioned very often, carbs became the main culprit around, and the discussion around diabetes became carbohydrate centric, and that's how the term sugar came. Yes, we need to be often very aware of the when we are speaking about these terminologies and all, we should be emphasizing that whenever talking about carbs, if you are blaming the carbs for sugar, diabetes, then we need to be very aware that we need to mention that it is simple carbohydrates, not the complex carbohydrates. That is how we can actually try to focus the attention from sugar, the terminology sugar, because diabetes is a lifestyle disease. It is a metabolic disorder where actually the derangement is handling with the carbohydrates, proteins, and fats as well. It is not only about the carbohydrates. I can clearly explain this with an example with a recent patient I met in my clinic. This guy came with like he was actually thinking that his diabetes is not under control, especially the fasting blood sugar, because he is taking a little high carbohydrate, right? But when he digged into the history, gone through the reports and asked about the lifestyle, his uric acid levels are pretty high, and the level of inflammation, the HSCRP is little high, and the nutrition part definitely is not taking high carbohydrates, and also not the simple carbohydrates. It's the red meat he is actually the intake is high, and which is a culprit for raised uric acid levels as well. When I counsel him very clearly that you need to come down on totally stop red meat and also come down on non-veg intake, your uric acid levels will be under control. At the same time, inflammation will be under control. Then obviously insulin sensitivity will improve, the resistance decreases, and fasting blood sugars will be under control. So this is a clear-cut example where our focus need to be very holistic, not sticking particular to a particular food item or something. That's how it is. Like.
Thank you, ma'am.
Thank you, ma'am. Okay, now let's move on to the next question. This question goes to Dr. Maitri Shankar, ma'am. Ma'am, when we think carbs, we think of simple sugars and staple foods, especially grains and millets. In your opinion, how wise is this common conception? And actually, what imaginary should come to mind when one hears the word carbohydrates?
I think this is a very common misconception. When it comes to carbohydrates, it's the quality which matters. You know, what is more important than the type of carbohydrate is what you choose to eat, because there are multiple different sources available. The amount of carbohydrate, whether it is high or low, that is less important than the type of carbohydrate. For example, whole grains such as whole wheat, rye, barley, anything with intact rice, brown rice, red rice, quinoa, oats, these are all better choices, and they are much better when you compare them to white bread or French fries or potatoes. I think that is the major distinction people need to make, and not generalize carbohydrate as something with sugar and avoid carbohydrate totally, irrespective of the source. I think that is a very common mistake people do. A good rule of thumb would be, choose grains which have at least 4 grams of fiber and less than 8 grams of sugar per serving. So that is a very good way to figure out if it is a good carb or a bad carb, if you want to call it that way. And make those choices where you're choosing less amount of processed foods, like eat a whole fruit instead of a juice. For example, a whole orange has almost twice as much fiber and half as much sugar when you compare that to a glass of orange juice, right? We all know this. So making that distinction in terms of the quality and the quantity of sugar which you're consuming, I think that is a very good distinction to make when it comes to carbs. And like they say, you pass the potatoes, but you get in the beans instead, bring in the beans. So there is a more healthy type of a carb, which are less slowly rather. It takes more time to digest when it is coming in from beans. And when you compare that to the type of carbohydrates coming in from potatoes, which kind of fill you up, and it's known to kind of promote weight gain. So beans, legumes, chickpeas, which an Indian diet is very rich in already. We have so many types of dals, pulses available, and they also have a good amount of carb. Trying to make that distinction, I think, is very key here.
Thank you, ma'am, for the valuable information. Next, we'll move on to question number 3. This question goes to Dr. Deepa Shukla. Ma'am, currently there is growing evidence that predominantly whole food plant-based diets can aid with diabetes management, and even the guidelines recommend the use of such diets. The predominantly whole food plant-based diet strategy provides a diet in which carbs are present in nearly every food group in varying quantities. Therefore, would you please explain that how could a diet high in carbs help in the prevention and management of the disease?
Yeah, thank you. Thank you for the question. So when we talk about whole food plant-based, So what do we mean by whole grains? Like as already Dr. Maitri said. So what is whole grains? Whole grains is nothing but any grain which has the entire kernel. That is, which includes the bran layer, germ, and the endosperm. So these are nothing but whole grains, like for example, brown rice, buckwheat, or quinoa. These all are the whole grains because it contains basically the germ layer. And other refined grains or carbohydrates, because when we are talking about high carbohydrates, so why we are talking about high carbohydrates? Because plant-based diets, it mainly emphasizes on legumes, whole grains, vegetables, fruits, nuts, and seeds. So these all group of foods contains mainly carbs. Like for example, if we say fruits, so fruits also contains carbs, cereals, grains, legumes. They contain legumes, and lentils also contain protein, but it also contains majority of the carbs also. But why these all carbs are high? So again, when we talk about, sorry, it's beneficial. So again, when we talk about carbs, there are different types of carbs, as already mentioned by previous speakers. Like we talk about refined and unrefined. So the whole grains are unrefined, and these refined grains are like suji, besan, the poha, which we use in our routine life. So suji is nothing but it is processed from wheat, right? Besan is nothing but it is processed, which is fiberless, which does not contain fiber, and it is also refined or processed. Then when we talk about these plant-based diets, it also excludes animal products, which we all know. Okay, so when we talk about animal products, it excludes even the meat, processed and unprocessed meat, any kind of animal foods like egg, fish, milk, and milk products. So there are few studies in which it is also mentioned that the cohort studies strongly support the plant-based diet. And there are few interventional studies also which demonstrate treating type 2 diabetes, which will also decrease the macrovascular and microvascular complications of type 2 diabetes. Like, for example, the diabetic neuropathy, then the kidney disorders which occurs due to the type 2 diabetes. Also, there is a cardiovascular risk due to the diabetes. So these all complications are also treated with plant-based diet. That is already proved. And the another potential mechanism when we talk about plant-based diet is it actually decreases the insulin resistance, and it promotes healthy body weight. It also, due to the increase in the fiber and the phytonutrients, the food microbiome interactions, and there is also decrease in the saturated fat. Like as we are talking about whole plant-based diet, so in whole plant-based diet, the carbs is more and fat is less. So in that, again, saturated fat is less. So because of the decrease in the saturated fat, the advanced glycation, end products, nitrosamines, etc., these due to these mechanisms, this plant-based diet is beneficial because it is less in these all things. And when we talk about these whole grains, so like whole grain bread, whole grain cereals, brown rice, these all are also proved in the research papers, in the research articles which I have gone through, that it is associated with decreased risk of diabetes mellitus. There is a proper systematic review and meta-analysis on this. And when we talk about fruits and vegetables, so in fruits and vegetables also, like all root vegetables, green leafy vegetables, blueberries, grapes, apples, these all are linked with reduction in the diabetes risk. And legumes are also proven to be reduce the insulin resistance. And if you take greater nut consumption, then also there is decreased risk in the type 2 diabetes. Then regarding the animal products, when we talk about, so animal foods like processed and unprocessed red meat, that is mainly talked about. And if we substitute the animal protein with the plant protein, then it is 23% reduction in the risk of diabetes. This is also proven in one of the papers. And when we take carbohydrates from the whole grains or the cereal fibers, which we already spoke about, many examples which we gave. So what will that do is that will reduce the risk of developing diabetes because the refined low fiber will increase the risk. And when we talk about high carb and high protein, that was also another research done. So when a research was done, high carb versus high protein, in that also the high carb people who took the high carb group of foods like bread, cereals, pasta, starchy vegetables, that also resulted in the reduce in the HbA1c, reduction in the fasting blood glucose, and increase in the insulin sensitivity. But when we compared with the high protein, which included fish, chicken, eggs, low fat milk, cheese, these all things did not have any significant changes. And even when we talk about decrease in insulin resistance, there is also increase in the glycemic control. And due to the high fiber and due to its content in antioxidants, like all these whole plant-based diet, that contains antioxidants, magnesium, and it also promotes insulin sensitivity. Then when we talk about antioxidants, like for example, polyphenols. So what are polyphenols? It is nothing but a micronutrient which is present only in plant-based food. So polyphenols are not found in the animal foods. And what is its function? That mainly these polyphenols, like for example, what are the examples of polyphenols? So flax seeds, chestnut, hazelnut, all types of nuts like almonds, and fruits like berries, which are, all colorful fruits and vegetables. So these are mainly beneficial for reduction in the insulin resistance. And it also stimulates the insulin secretion, and it also inhibits it also reduces the hepatic glucose output and the glucose uptake. So because of that, the sugar levels are reduced. And when we talk about high fiber, when we also talk about high carbohydrates, high fiber, so that is also found more in the plant-based foods. It is fiber is not present in the animal foods or the any kind of animal foods. So what the fiber will do is, mainly this fiber will modulate the postprandial glucose response. And this is fermented by the intestinal bacteria to produce short-chain fatty acids. So what these short-chain fatty acids will do, it will improve the glucose response, it will insulin signaling, it will improve, and even the insulin sensitivity. And generally when we take fiber...
Time is up, ma'am. Yeah, time is up.
Okay, yeah, just 2 minutes. So if this dietary fiber, that is also will reduce the inflammatory markers also. And when we talk about saturated fat, which is not present in the plant-based diet and it is present in the animal food. So why we should reduce the animal foods? That is because it contributes to lipotoxicity. So lipotoxicity is nothing but there is toxic fat metabolites which accumulate in the hepatic and skeletal muscles and muscle cells. And because of this, there is impairing insulin signaling. And because of this, it decreases the glucose uptake. And the plant-based diet, that is also reduces the visceral fat, and it improves the markers of the oxidative stress. So as the oxidative stress is reduced, so because of that, the insulin resistance is improved. So these are all the, in short, mechanism through which we can say that, yes, definitely whole plant-based diet is beneficial for type 2 diabetes.
Thank you, ma'am. Thank you for the insights. Okay, the next question goes to Dr. Patricia, ma'am, again. Dr. Nitish, okay. The question number 4 is, how do we contrast the role of high carb whole food plant-based diets in diabetes management with other diets like low carb, low calorie, and ketogenic diets?
So when we think about lifestyle disorders like diabetes, we need to understand that all the lifestyle modifications we advise the patients are for a lifetime. They're not temporary, actually. So whatever is restrictive, it cannot be followed for a long time. But our idea of helping our patients or ourselves is like being slow, sustainable, and they should be able to follow it in a simple way, understand what is good for them in their language. So when it comes to low carbs, actually it should be like low simple carbs. Again, as I mentioned, whenever we are talking about harmful carbs for diabetes, we need to always emphasize that it is simple carbs, not the high carb diet. And when it comes to low calorie diet, it is restrictive. Obviously, when we stick to low calorie diet, there will be a lot of cravings. And patients, when they are in cravings, they don't have control of choosing the food. That actually does more harm than what they are following and expecting the results to happen. When it comes to ketogenic diet, there is no need to explain at all because they are so restrictive. They can't be followed on a long term, and they causes micronutrient deficiency, a lot of complications when it comes to raised uric acid levels and high cholesterol levels. And then when it comes to high carb, whole food, plant-based diet, these are very holistic and very physiological because people can easily understand, and it is filling. It promotes satiety. It actually helps in bowel movements, and it helps in uh, the growth of gut microbiome. And there's so many, and also the high carb diet. For example, all the previous speakers have elaborately told about what is high carb, whole food, plant-based diet. Basically, it is rich in fiber, it is rich in micronutrients. So the three parameters mainly it focuses on is like increasing the fiber so that the cholesterol absorption decreases, the absorption of sugars will be like high fiber diet actually delays the postprandial emptying so that there will be time for the body to secrete enough insulin. And also high carb also contains pulses, which are like whole. So when these pulses have considerable amount of good quality protein, it again promotes satiety. And they are all vegetables, fruits, pulses. We are talking about beans and all these things. They are very good in micronutrients as well. When it comes to a diet which can be more physiological, more sustainable, more holistic, then it would be like high carb, whole food, plant-based diet. Not the other diets because they are restrictive. Uh, Actually, they don't promote the holistic health in the terms of gut health, in terms of cholesterol, in terms of satiety, in terms of curbing the cravings. Because when it comes to cravings, again, micronutrient deficiency causes cravings. When it comes to low calorie diet, that again causes cravings. When it comes to ketogenic diets, micronutrient deficiency promotes cravings. So overall, what is happening is when you are following a restrictive diet, your aim is something, but you are landing at something. And also, these are temporary, definitely not sustainable or a long term. And all the lifestyle diseases, even before getting the diseases, if you want to maintain your health, if you want to prevent the lifestyle diseases, then whatever diet you are following should be sustainable and it should be simple. So that's how high carb, whole food, plant-based diets are more physiological, more simple, more sustainable, more understandable, and more available and not complicated. They're not restrictive. There's so many things we can advise. And that's how these help in management of diabetes and also help in preventing diabetes and managing weight and also managing the cholesterol levels and also supply adequate nutrients. So yeah, that's how I totally recommend high carb, whole food, plant-based diet for all my patients, especially to manage their diabetes and also to prevent the diabetes.
Thank you, ma'am. Thank you for the amazing insights. Next question goes to Dr. Maitri, ma'am, again. Next question, Dr. Nitesh. Question number 5. Ma'am, what are the potential challenges or limitations associated with adopting a predominantly whole food plant-based diet for diabetes management, and how can these be addressed?
So when you're looking at changing yourself into a vegan or a predominantly vegan or a whole food plant-based diet, I think the challenges are kind of the same across, whether it is for diabetes or heart disease or any other chronic disease spectrum or a lifestyle disease we are looking at. A couple of things are particularly important for diabetics, which is differentiating and understanding better the glycemic load versus the glycemic index. That's one main thing for starters. And to understand what in the glycemic index is a high glycemic and a low glycemic index. So practically making your patients understand or clients understand that from a decision point, when they're picking up and putting something in their plate, it needs to be very clear in their head where this falls. First, they need to be very clear on what is plant-based. Most of my clients, they say, no, we are totally vegetarians. For them, vegan or vegetarian, it's almost the same. It's almost synonymous. And then you have to go an extra step and tell them, well, dairy is an animal product, milk, sugar, milk, curds, even cheese, paneer, and even honey for that matter. These are all animal products. So bringing in that distinction. And if you are like me, a South Indian, oh, curds, yogurt, then what do I eat? I mean, that is my main diet, right? So that's another thing. So telling them or having those alternatives in terms of what are the good nuts for making plant-based nut milks, for example, or yogurts, or using plant-based curds, making it, buying it, which are the good brands, which is good to buy initially when you're in transition, but eventually you do want to be sustainable at home, and you do want to be making it at your own home, not just to save costs, but also to avoid a lot of preservatives and the packaging and what have you. I think those two things are very key transition points. Once they get that right, how do you make your own plant-based alternatives? I think that's a big challenge, and that's half the battle won. After that would be, okay, now I'm going to be eating only vegetables and fruits and everything which is plant-based. So does that mean, oh, my doctor said I have to eat 3 fruits in a day? That doesn't mean you can eat 1 watermelon and 1 pineapple, right? So it means, making them understand the quantity of what is a serving size and how much of that. And if they really are craving mango, like now it's the mango season, they can have a small slice, but instead it would be equivalent to maybe 3 papaya slices, 1 slice of mango, giving them that kind of correlation in terms of the glycemic load. The glycemic index in certain fruits like low, moderate, and high. What fruits fall in which category? If they just like when you go shopping, you are looking at the price tag. Is this too expensive? Is this value? Is this in my budget? We are fine-tuned to that. In the same way, I think diabetics need to automatically come up with that sliding scale or number making in their mind that, oh, these are the fruits which are low glycemic. If I want to snack, if I eat raisins, that's going to raise my sugar faster. Instead, I can eat apricots, which are also dried fruits, but they would spike a lot later. And another example would be for vegetables. There are certain vegetables like potatoes, sweet potatoes. They are okay, but they do spike much faster. So instead, if you could do a lot of cruciferous vegetables or carrots or beans and even maybe peas, which are higher in protein, that helps you build a muscle, which in turn, when you have more muscle, your BMR increases and you tend to burn more calories and therefore reduce your sugar levels faster, making in those kind of switches between what is a more appropriate choice for me, and not from a standpoint where I'm being deprived. I don't want to feel deprived. I can't eat, mangoes, my favorite fruit in the mango season, but I can have it, but just a little bit, maybe the last slice, the last, like a dessert, I can have a little bit and I can have smaller bites. Giving them that practical tips, I think, helps them overcome a lot of these challenges and limitations.
Thank you, ma'am. Thank you for the insights. So, as we've come to, yes, Dr. Nitesh.
Yes, I think, ma'am, there is a question in chat box. If any audience want to ask their question, they can turn on their mic and ask, or they can also put their question in the chat box.
I see a question on the so-called healthy diets prescribed expensive, hence becomes unaffordable for a long-term adherence. Um, it used to be the case a little while ago when most common grains, when we are talking about grains, what is recommended tended to be oats or quinoa. But now we have a lot of millets available. The millets are basically classified into the large or the small, right? Big and small millets. If you are doing ragi, which is a major millet, a bigger millet, instead of rice, your sugar would still spike the same. However, if you can go deep and look at the carbohydrate fiber ratios in each of these millets, you will find that at least for me, there were 3 or 4 millets I was spiking less too. So millets are something grown locally. This is the grains which our ancestors ate. And if you look at the nutrigenomics or the epigenetics impact of the foods that we eat, it takes about 7 to 8 generations for our genes to get adapted to the new foods, particularly rice or wheat, which first of all is not whole food. The rice which we eat commonly, white rice, it's stripped of all its nutrients. Same with wheat and many other things out there. If you go in for the unpolished variety, particularly in millets, I think those would be a great choice. Common problem with millets is they have some kind of GI symptoms. So start with small quantities, let your gut get adjusted to it gradually, and soak them for about half hour before you cook them. Any millet, they are all called same akki, navane akki. Akki is rice, so they are all different and original forms of rice, traditional to India per se. So I think those would be a great choice to switch to, which are not very expensive, and you get a good organic brand or a series also these days. So I would say definitely consider millets here.
Actually, I want to add, and I want to answer this in a more practical way, because I know space from which the question is coming. Whenever we are advising our patients, definitely I also come across this, like, how can we afford all these things? How can we follow these things on a long term? So advising them about the diabetic plate method is the most feasible way, most practical way, and most sustainable way, I feel. So I tell them, I draw the plate and I tell them, like, 1/4 you can fill with salads, 1/4 with plant-based, predominant plant-based protein or sprouts, and 1/4 whatever carbs you are having, you stick on to the 1/4 portion, and 1/4 you go for your curry. And when it comes to morning breakfast, I ask them to take green smoothie and cut down the breakfast to 50%. And also, most of the times, the evening snack would also be green smoothie and early dinner. Compulsory salads and sprouts or vegetable-based proteins in lunch and dinner. And the morning and evening would be green smoothie and cut down the breakfast to 50%. So this is how I'm able to give this practical advice and getting very good results in terms of sustainability. They maintaining these results, following them, even for the lay people. So, and it is actually working for me. I draw the figure of like a bowl of salad you need to incorporate, and most of the patients are able to stick to this. And it is very simple, and it is very simple to follow and also to explain. So even if you're taking white rice, you're sticking to the portion, like 1/4 of your plate, the cereals are not exceeding, especially for people who can't understand all these things or who can't incorporate all these things on a daily basis. It works.
Thank you, ma'am, for the insights.
I would like to add here something.
Okay.
Like as we are talking about expensive and affordability, so when we talk about that, we can also explain our patients in such a way that when we are following whole plant-based diet, we are not at all taking milk and milk products, any kind of dairy products. So the ghee is reduced, milk is reduced, yogurt is reduced, and even the oil, refined oil is reduced. I usually prefer even zero oil cooking, or if zero oil cooking is not possible, then I recommend my patients to use the cold pressed oil, whichever they prefer. So if these things are reduced, in front of that, when we advise them fruits, vegetables, nuts, so I think when we explain them in such a way, that time this is not so expensive. Another thing is, when we talk about nuts, it's not necessary that everybody should have almonds or walnuts only. They can have any kind of nuts. They can also have simple ground nuts. They can have any kind of lentils and pulses, and these will also improve the insulin resistance. Plus, if they are having craving for any kind of sweets, so instead of taking sugar, jaggery, or honey, I recommend them to take dates, figs, or raisins. Even in spite of taking these all and any kind of fruits like mango, banana, any fruits XYZ, they are not, they are maintaining their sugar levels. Like in my experience, I have seen that when I give all these kind of foods to my patients when they are admitted to a naturopathy hospital, usually their insulin units also will be 30-40, but still it comes down to zero, and it slowly reduces. So according to my experience, what I feel is it's not at all difficult, but the only thing is we need to counsel our patients, we need to convince them, we need to tell them about the different recipes, as like Dr. Maitri mentioned. So plant-based milk also we can advise, like almond milk, coconut milk. They can also take, instead of paneer, they can take soya tofu. Instead of normal dairy product, milk and buttermilk and curd and buttermilk, they can prefer plant-based yogurt and buttermilks. So and regarding the sweets, I already mentioned. Regarding the namkeens, or if they are craving for any kind of namkeens, that time we can advise them for flax seeds or any kind of seeds which is roasted, or even soaked also we can prefer. We can advise for roasted makhanas, roasted groundnuts, roasted bengal gram. So these all is what I recommend to my patients, and my patients, they easily get convinced and counseled also, and then they follow this. And really, if they follow, definitely they'll get very good results. I have seen this in my experience. Thank you.
Thank you, ma'am. Thank you for sharing your insights. We have another question in the chat box from Pushparani Ashokan. What are the practical advice for vegetarians to increase protein in the diet? Anybody needs to answer? Actually,
I already mentioned, like for protein, they can take any kind of dals, lentils, any kind of peas, legumes, like for example, chickpeas, which is the Kabuli chana, which we use, the Bengal gram, which is the Kala chana, which we use, the moong, which is the green gram, the rajma, which is the kidney beans or red beans. So in these way, any kind of lentils, even the masoor dal, tur dal, these all are the lentils. So these all can be taken in any form, however they wish. Even they can make chilas out of it, dal paratha or dal chila without oil and ghee. Even they can make in form of dals. They can also make in form of idlis. So in any form, and plus these nuts and seeds also has high amount of protein. So in this way, like people have this misconception that if they stop these milk and milk products or the dairy products, they will not get the sufficient nutrition, the calcium, protein, all such things. But the nuts and seeds, the fruits and vegetables, and these whole grains, they contain more amount of calcium and protein than the refined grains and the milk and milk products.
thank you, ma'am, and also Pushparani ma'am. We have already had discussion about protein in the discussion forum previously. It's like there'll be detailed discussion. You'll get good points from that video. You can check on YouTube of the PAN's YouTube channel. Thank you. Any other questions? Okay, I think we have come to an end today. Dr. Nitesh, are you there? Would you like to summarize everything?
Yes, sure, ma'am.
Okay.
Thank you, ma'am. So, in summary, Uh, as Pratyusha ma'am said that simple carbs are not good for the diabetes, but contrary to this, complex carbohydrates are in fact helpful. And in uh, diabetes mellitus is the metabolic disorder, and that means that it is not only related to carbohydrates, but we also need to have holistic approach while managing this disorder, because it is of importance to have balance between all the micro and macronutrients while when one consider to manage it with the lifestyle interventions. Also, as Maitri ma'am said that while choosing foods, we need to consider whole foods over processed foods. And apart from cereals and grains, there are also other sources of carbohydrates such as legumes, vegetable, fruits, and also the nuts and seeds. They can also provide good amount of carbohydrates which are complex in nature, and in fact help in improving their insulin sensitivity and glycemic control. Also, the processed foods are uh, actually fiberless and nutrient deficient foods, and along with them, the animal foods are high in saturated fatty acids, which is associated with various metabolic disorders and cardiovascular disorders. But contrary to this, WFPB diets are rich in fibers, micronutrients, and antioxidant properties. And all these things are associated with positive outcomes in diabetes. The whole foods are minimally processed plant products are associated with increased sensitivity for insulin. High carbohydrate there is one study where they compared high carbohydrate diet versus high protein diets, where the source for protein was from animal origin. So they found that the high carbohydrate diet was associated with good outcomes compared to these high protein diets which are rich in animal sources. Apart from this, the plant-based diets are rich in polyphenols. So these polyphenols are beneficial to reduce insulin resistance and improve hepatic glucose uptake. And these plant-based diets are also associated with decrease in visceral fat and resultant improvement in the condition. The diabetes management is lifelong process, and so though diet like low carbohydrate, low calorie diet, and a ketogenic diet may be beneficial in short term, but these are difficult to follow in long run, and therefore we need a diet which should overcome all these barriers. And on these grounds, the predominantly whole food plant-based diet uh, seems to be more promising option. But there are some challenges associated with adopting predominantly whole food plant-based diets. These include the minimal understanding related to the glycemic index of various food groups, uh, distinction in distinction is need to be made between various categories of plant-based diets, like what are lacto-vegetarian diets, what are ovo-lacto-vegetarians, and and what is actually the predominantly whole food plant-based diet. And also there is need to teach our patients about how to swap their high calorie foods or high glycemic index foods with nutrient dense foods. There is a there is also a misconception that a healthy balanced diet is always an expensive one. But as all our today's panelists mentioned, just by following predominantly whole food plant-based diet, and by balancing for various food groups with the locally available food sources, people can have a healthy balanced diet which can help them in managing their diabetes condition. So these are the takeaways from today's meeting. I would like to thank our today's panelists for uh, giving their valuable time for us. Thank you, Maitri ma'am. Thank you, Pratyusha ma'am, and thank you, Deepa ma'am, for joining us today and sharing your valuable insight with us. I also would like to thank Pan India's leadership board for providing us this wonderful platform. And last but not least, I also would like to thank our audiences for uh, joining us today. And I would like to thank my team also for their continuous support in this process. So with this, on this note, I would like to announce that today's session is successfully completed. We will meet next month on 4th Thursday with another session on another session on role of whole food plant-based diet in the management of chronic health conditions. Thank you all.
Thank you.
Thank you. Good night. Thank you
Thank
all.
you.
Good night. Good
Thank
night.
you.
Good
Thank you
night.
so much.
Actually, before closing this session, I would like to mention that next month we will be having a session which will be based on cases, which will be conducted by Dr. Smriti ma'am, Smriti Naswa ma'am. So please stay tuned for that, and we will soon share the updates related to that. Okay.
So case basis means how and what is the topic?
Ma'am, for next 2 months, the topic will be only the diabetes. But next month we will be having session where there will be a case. They will discuss that case, and will have a discussion on that case, and there will be more practical means how these guidelines and all these nutrition related theoretical knowledge, how we can apply this knowledge in our day-to-day practice. So that will be definitely an interesting session. So I request you all, please stay tuned for that. Okay. Good night, all.
Thank you,
good
Dr.
night.
Nitish. Good
Thank you.
night.
Thank
Good
you.
night.
Thanks.
Bye. Bye.
Thank
Bye.
Okay, good night. Good
Good
night.
night.
Bye bye.
Bye. Bye.